Okay, let's unpack this. We're diving into something really specific today, something you sent us because it's crucial for your path, preparing for a community health worker interview.
That's right.
This role is incredibly rewarding, but, well, as the source you shared points out right up front, it can be challenging to actually land the job.
It really can. And the source material guiding us today is a really practical article, Career Sidekick, I believe.
Yeah, career sidekick.
It lays out common questions and gives pretty solid tips specifically for, navigating this interview process.
So our mission together in this deep dive is to kind of cut through the noise, pull out the absolute essential knowledge from this article.
Right.
We want you to walk away feeling, well, truly prepared and confident for that interview.
Think of it as getting a clear picture of exactly what hiring managers are looking for, like directly from someone who's broken down this specific interview.
And understanding how to articulate your fit powerfully.
Exactly. How to sell yourself, basically.
And the article makes a key point. The interview isn't just a formality. It's your moment to shine, to really showcase your passion and prove your suitability for this vital position.
And suitability for a CHW role is fascinating because it's not just like technical knowledge. It's a specific combination of maybe innate qualities and learned skills.
Okay.
The article identifies 6 core areas hiring managers tend to focus on.
Okay, let's see what those are. First up, it highlights interpersonal skills, things like empathy and active listening.
Which makes total sense, right? The article points out these are fundamental because they allow you to build strong, trusting relationships.
Not just with clients either.
No, with colleagues, partners too. You can't really help effectively if you can't connect,
Okay, so once you can connect with people, how do you actually share information effectively? That leads to the second point, communication skills. It's more than just talking. The article emphasizes being clear, concise, both verbally and in writing.
And here's a crucial nuance from the article. Adapting your communication style. That's huge.
Adapting how?
Well, you need to be able to simplify complex health information, right? And adjust your language for really diverse audiences. People with different backgrounds, different levels of health literacy. You become that vital bridge.
Which flows directly into the third quality they look for.
Yeah.
Cultural sensitivity. I mean, working with incredibly diverse communities is the heart of this job.
Exactly. The article really stresses the importance of demonstrating a deep respect for different backgrounds, beliefs, traditions.
It's about showing you understand how to navigate cultural differences respectfully.
Yeah, and create an environment where everyone feels included and understood. That's key.
The fourth quality listed is compassion and empathy. The article links this directly to connecting with clients on like an emotional level, providing support.
And understanding things like mental health challenges, too. It's that essential human element.
Right.
Making clients feel genuinely cared for and supported, especially during difficult or vulnerable moments, is pretty much non-negotiable for a CHW.
Number 5 is organizational skills. Boy, the article lists things like managing appointments, coordinating with providers, keeping accurate records. Whew, that sounds like a lot to juggle.
It really does. And the article makes it clear this requires strong multitasking and prioritization skills.
You got to show you can handle the practical side.
Demonstrating you can manage your workload efficiently shows you're reliable and can handle the kind of day-to-day demands of the job.
And finally, number 6, motivation and self-management. This role often requires a lot of independent work, right? Even when you're part of a team.
Absolutely. So the article highlights the need to show your drive, your ability to manage your own time effectively.
Like, can you stay focused?
Can you stay focused and productive without constant supervision? That self-reliance is key.
Okay, so hiring managers aren't just looking for a friendly face or someone with, technical medical knowledge. They're looking for this very specific blend.
Yeah, it's the ability to deeply connect, communicate effectively across barriers, respect diverse cultures, show genuine care, stay organized, and manage yourself. It's a tall order.
It really is.
And the common interview questions they ask are specifically designed to probe these very qualities and skills. The article gives us strategies for several key ones.
All right, let's tackle those questions then. The classic opener. Tell us about yourself. The article calls this the chance for them to really get to know you.
It does. And the advice from the source is keep it focused, keep it relevant, highlight experience, achievements, and what genuinely motivates you about this role.
So not your whole life story.
Definitely not. It's your professional narrative tailored to the job.
The structure it suggests is smart touch on your relevant background, a key achievement, your passion for the field, and relevant skills. It's a concise way to cover the essential ground.
Which often leads right into the next question. Why did you choose this role? This isn't just asking for your job history.
No, it's deeper.
Yeah, it's assessing your deeper motivation and commitment to being a CHW.
The article is really clear on the do's here. You absolutely need to show genuine passion, connected to specific experiences that sparked your interest, and explain how this work aligns with your personal values and maybe long-term goals.
And the don'ts are just as important according to the source. Avoid making it just about the paycheck or, job security.
Don't be generic.
Right? Don't give an answer that could apply to any helping profession. Show them why being a community health worker specifically resonates with you. The sample answer provided focuses on a passion for making a tangible difference, maybe through volunteer work, showing you've seen the impact firsthand.
Okay, shifting gears.
Right.
How do you show them you can handle the tough stuff? The article includes a question about a challenging situation you faced.
Ah, yes. This question is designed to see your problem-solving skills and how you handle pressure, something you'll definitely encounter as a CHW.
So how should you answer?
The article recommends a clear structure. Describe the specific situation, detail the exact steps you took to address it, and then explain the outcome, or, importantly, what you learned.
And the source gives a really compelling example. Dealing with community resistance to, say, vaccination initiatives in a rural area.
Right, a common challenge.
The sample steps taken involved proactive engagement, organizing a community meeting, bringing in local healthcare experts to collaborate.
Presenting information in a relatable way and working towards a consensus that shows initiative.
Exactly. And the outcome was positive, leading to increased vaccination rates. That's showing real impact.
That example perfectly highlights a crucial skill the article touches on elsewhere, too. Building trust and adapting communication.
They are linked, aren't they?
Fundamentally linked in this role. Trust is the foundation. The article mentions these in relation to different questions, but yeah, it all comes back to trust.
And adapting your communication is how you ensure that trust translates into effective action.
Right. Precisely. The source offers several strategies for building trust, like having genuine conversations, truly listening actively, showing empathy, and just being consistent in your interactions.
And for adapting communication.
Well, it's about meeting people where they are. The article suggests, learning about cultural communication preferences, using simple, clear language, no jargon, leveraging visual aids sometimes, and actively confirming that the person understands what you've shared. It's about making sure your message lands effectively with each individual.
Okay. The article also digs into how you would promote health within a community and, importantly, how you demonstrate the success of those efforts.
Yes. Questions 9 and 10, I think. 9 asks about effective strategies, and 10 is about giving examples of successful programs you've been involved with.
What strategies does it suggest?
The source emphasizes using a variety of channels for health promotion, things like community meetings, social media, even old-school door-to-door outreach sometimes.
Right.
And critically, just like with individual communication, adapting those messages culturally and linguistically is key. Plus, engaging local leaders can also be vital. Get buy-in.
Makes sense. And for showing success, how do you prove it worked?
Well, the article provides a great example of a diabetes prevention program in a rural community. The sample answer details the CHW's specific role and activities, things like outreach, running workshops, providing one-on-one coaching.
Okay, so what you actually did.
Yes, but also mentions vital partnerships with schools, healthcare providers, community groups, showing you worked within the system.
And the results.
And the outcomes mentioned are concrete, like a measured decrease in the prevalence of diabetes and increased community awareness. That's how you show impact. You weren't just busy, you made a measurable difference.
Collaboration is another area the article explores, asking about working with other professionals or organizations. This is crucial because you won't be working in a vacuum. You're part of a larger support system.
Exactly. It's about showing you can navigate the healthcare and social service landscape and leverage resources effectively.
What kind of examples does it give?
The article gives examples like collaborating with local clinics, hospitals, nonprofits, coordinating services, maybe sharing information or resources, and setting up joint events like health fairs. It's all about connecting clients to the help they need efficiently.
What about handling the unexpected? The article includes a question about a crisis or emergency situation you've dealt with.
Yeah. This tests your ability to think on your feet, respond quickly and effectively when things are urgent.
And the advice for answering.
It mirrors the challenging situation question, really. Tell a specific story, detail your actions step by step, and share what you took away from it, the lesson learned.
The sample situation provided involves a family suddenly facing severe food insecurity due to job loss.
The tough one.
Very tough. And the CHW's response highlights rapid resourcefulness, immediately contacting local food banks, securing temporary aid.
And then longer-term help, too. Yes, connecting the family with employment assistance and financial literacy programs, looking beyond the immediate crisis.
And the takeaway.
The lesson learned in that example, as highlighted in the source, is the absolute importance of quick action and knowing how to tap into those local resources and support systems without delay. Knowing who to call.
Right. Shifting gears a bit, the interview will likely touch on your future. Where do you see yourself in 5 years?
Huh?
That old chestnut.
Yeah. It assesses your long-term dedication and potential for growth within the field. They want to know if you'll stick around.
So what are the tips here?
The article's tips are to show you're thinking about progression, demonstrating your commitment to community health work specifically, and being realistic about your aspirations.
Realistic is important.
Very. The sample answer suggests things like maybe taking on leadership roles or pursuing further education, perhaps a master's degree, to deepen your knowledge and impact. It shows you're invested in the field.
Okay. And finally, the article looks at how you stay effective over time, staying updated and measuring your success.
Crucial points. How do you keep learning, and how do you know if your work is actually making a difference?
Continuous learning seems vital in a constantly changing field like health.
Absolutely. The source suggests staying current through things like professional journals, newsletters, conferences, workshops, and joining professional associations. Staying plugged in.
And evaluating success. How do you measure that?
Well, the article explains this is crucial for understanding your impact and figuring out what strategies are working and maybe which aren't.
So you can adjust.
Exactly. It lists indicators like increases in health screenings, improvements in specific health outcomes for clients, or maybe higher client satisfaction rates, concrete things.
Those are tangible ways to show that your efforts aren't just, activities, but are leading to positive changes.
Right. They reflect your impact and provide data you can actually use to refine your approach over time.
So they want to see that you are committed to growing your knowledge and that you can demonstrate the tangible positive results of your work.
That's the bottom line.
Okay, so the article wraps up with some essential final preparation steps. These are the nuts and bolts, the things to do right before the interview to maximize your chances.
Absolutely critical steps. Practice answering these common questions out loud. It makes a huge difference. Seriously, don't skip this.
Practice helps it feel less like reciting.
Totally. And do your homework on the specific organization you're interviewing with. Understand their values, their goals, so you can tailor your answers.
That research shows genuine interest.
Yeah.
Right? And helps you connect your skills directly to what they need.
Exactly. The article also suggests briefly reviewing any local health laws or regulations relevant to CHWs in that specific area. Shows you're prepared.
Good tip.
And don't forget the practicalities mentioned. Dress professionally, have multiple copies of your resume ready, bring a list of professional references.
And gather any relevant certifications. Have your ducks in a row.
Yep. And finally, the article stresses showing enthusiasm. Arrive a little early, engage actively in the conversation.
Don't just sit there passively.
No, lean in. And definitely have some thoughtful questions prepared to ask them. It shows you're serious and engaged.
Following these steps, straight from the article, can really boost your confidence and help you make a strong, lasting impression.
Definitely.
So we've taken this source and pulled out the key qualities hiring managers zero in on, broken down how to approach common questions using the article's examples and strategies, and covered those vital last-minute prep tips. Hopefully this dive helps you feel more grounded and ready.
Yeah, I think what's really highlighted here, reflecting on everything the source covers, is that a truly effective community health worker embodies this dynamic blend.
Blend of what?
It's about having those essential human qualities like deep compassion, empathy, and cultural sensitivity, but also coupling those with practical, measurable skills.
Like organization.
Like strong organization, self-management, and the ability to actually evaluate whether your work is moving the needle.
Yeah, the impact part.
And the source makes a compelling point that continuous learning isn't just like nice to have, it's fundamental. It's how you navigate the ever-changing landscape of community health needs effectively.
Something to definitely keep in mind as you head into that interview.